a budget to breathe. Got a plan in your hand, save a little each month, feel good where you stand. No more guessing around, no more tax time stress, just a clearer path and a whole lot less mess. Take a breath, look ahead, it's simpler than it seems. One small step today can turn into big dreams. Find your way, find your way. Save money, stay smart, find your way. HealthGap AI.com, HealthGapAI.com. Easy to remember, find your way. For the scout on the move for.
So we are going to talk today about an important thing that I've been doing, which is why I haven't been here lately. Okay, that's what I've been doing. This is what I've been doing for a while. And the reason being that I haven't been here. Okay, so we're going to talk about why healthcare is broken and what we can do about it. HealthGap AI. So hello everyone and welcome. I am Mari, founder of HealthGap AI. Today we're going to talk about something that affects almost every person in America, regardless of income, race, politics, or where you live. Healthcare. Not just insurance, not just doctors, not just hospitals, the entire healthcare experience. Because the reality is that millions of Americans aren't just struggling with healthcare costs. They're struggling to understand the system itself. And when people don't understand the system, they often delay care, skip medications, ignore symptoms, or end up with medical debt that could have been prevented. My goal today is not to sell you anything. My goal is to educate you, to show you resources, to share what I've learned after years in insurance and healthcare advocacy, and to explain why I built HealthGap AI. So I didn't wake up one day and decide to build a healthcare platform. This came from seeing the same problem over and over again. Guys, people will call me and tell me, hey, I need health insurance. But what happened usually is that they didn't make enough, they made too much money for Medicaid, which is for low income people. They didn't make enough money for ACA, which is Obamacare, and they end up falling in that gap. And a lot of the times I couldn't help them. And that frustration is what got me to this point. So I will talk to people who had insurance but couldn't afford to use it. People with deductibles so high they would avoid doctors. People who didn't know where to go for care. People paying full price for medications because nobody told them there were alternatives. Veterans who didn't know that what benefits they qualify for. Families overwhelmed by paperwork. Small business owners trying to protect their families while juggling bills. The more people I talk to, the more I realize something. Healthcare doesn't have an information problem. It has an access problem. The information exists. Most people just don't know where to find it. And this is why healthcare feels broken. How many of you have ever received a medical bill and had no idea why it was so high? I'm going to wait because I know that you say you. How many of you ever delayed care because of cost? How many of you have been afraid to go to the doctor because you didn't know what it will cost? Most people can relate. The healthcare system is incredibly fragmented. Think about it. One company handles insurance, another handles prescriptions, another handles billing, another handles hospitals, another handles specialties, another handles financial assistance, another handles transportation, another handles telehealth. The patient is expected to connect all of these pieces, but it's a puzzle. And most people don't have the pieces to complete the puzzle, and they're frustrated. That's like asking someone to build a car while driving it. And this leads me to things that I've noticed so many times when I'm talking to people. Common healthcare mistakes. Using the ER for everything. Like the other day, I was actually looking online, and somebody said that they went to the ER because they had a toothache. Well, the ER is not going to do anything with that. Emergency room saves lives, but many people end up there for issues that could have been handled elsewhere. That can mean thousands of dollars in unnecessary costs. Number two, second mistake is ignoring preventative care. Many serious conditions are cheaper and easier to manage when caught early. Waiting usually costs more. Third mistake, paying bills without reviewing them. Medical billing errors happen galore. Always review bills. Always ask questions. Always request itemized statements. Mistake number four, assuming no help exists. There are assistance programs, guys, discount programs, community clinics, charity care programs, prescription assistance, and more. But many people never hear about them. Which brings me to talk about what is HealthGap AI. This is where HealthGap AI comes in. HealthGap AI is designed to help people navigate healthcare, not replace doctors, not replace insurance, not replace financial advisors. Navigate. Think of it as a healthcare GPS. When you get lost driving, you don't want a lecture, you want directions. Healthcare should be the same way. So, what makes healthcare AI different? And I'm going to actually show my, oh, give me a second. I'm going to show share my, oh, this is weird. Okay, give me a second, guys, because I'm having a technical issue here. Let me see. Okay, now I have it. I'm going to share my screen so that you can see why I'm so excited about healthcare AI. Health Gap AI, sorry. Just my God. Can't even, at this time of the day, I'm completely, you know. Okay. So let's show this. I need to share my screen. Okay. So Health Gap AI is a place that helps you navigate the healthcare gap. And that's, like I said, I did this for the reason of people needing something that they didn't know where to get, or me being unable to actually help them. So here we got different things that you can get from the website. We got a health risk assessment, a financial risk assessment, personalized recommendations, healthcare roadmap, provider search, resource discovery, prescription savings resources, veteran resources, CHAMP-VA and TRICARE dependent, veteran dependent resources. The goal is simple: help people find care faster, help people reduce costs, help people make informed decisions. So Let me show you a little bit around the website so that you can see why I built this. Okay, so go back here. So the first place that it comes here, it says start my free assessment. You can start an assessment that gives you more key in results because you're answering some questions. Okay. Um, if you need to get health resources right away, just go here and put um, your zip code, put your age. Let's say that you're 65 and older, and then you have Medicare, and then you go here, and then it shows you different places where you can get different things that you need. Like a sample, Central County Center for Mental Health and Mental. So if you need that service, you can go there. This is this guy, Glenn Couchman. So there's different things. We have also, if you want to like speed up the process, you can get curated picks for your situation for a little fee. You can talk with an advisor, which is me. And if you want the deeper search analysis, you need to do the full assessment. Well, let's say that I need more information and I go here. So I go 76505 and then search. And then it tells me if I need a dentist, I can go there. Okay. If I want, right? So also, if you're a veteran, you can come here to the veteran resource. We have the veteran crisis line where you can call from here if you feel that you are in a dark place mentally. The text and the chat online. Okay. So let's say that you are in 76501 and you need to find out where is the nearest facility to you. Well, we got several facilities near you. For example, you got the Doris Miller VA Medical Center or the Olin E.T. Veterans Medical Center. If you need to search for a healthcare provider, you can go here. If you need to find community care, if you need to apply for VA healthcare, you can go here. VA benefits overview, My Healthy Vet, VA forms. There's a lot of things that people need. Forms, support programs for caregiver support program, mental health services, geriatrics extended care, va.gov, and then we got the Chant VA providers. So this is for dependents. So now we go again, and let's say that 76505, and then you want to see what, and we got Sheena Simon, internal medicine. Let me go back here too. And then here we got Ellen Agan. So if you need midwives or anything directly to that, you can click there. So let's say that you're looking for a OBGYN. So we got one here. You have to call to verify coverage. And again, the free assessment is here and you can do it in English and Espanol. I made this website so that people that speak the Spanish can actually go here and get their questions answered. Okay. Go back here to English. So if you want to become a partner, you can come here and contact me. If you want to just get resources. Example, let's say that you have a bill that is very expensive you have health insurance or you don't have health insurance, you can go and click here. And this will take you to a company that deals with those things specifically. Here we got hospital charity care, patient financial assistance, you got virtual access to doctors, all kinds of things, community health clinics. If you want to find a community health clinic, you can click here and then you can see what is nearby you. If there's nothing nearby you, then go to the next here, all providers, the next zip code or whatever, right? Going back to the resource page, there's direct primary care. That is basically a way that if you don't have health insurance, you do a deal with a doctor and you pay a specific amount monthly, and when you need something, you go there. Health insurance, and we got a private insurance, health insurance that is underwritten, so you have to get approved. Short-term medical, healthcare savings. Let's say that you want to get insulin. You can go here, and it takes you here, and it lets you know where you can get insulin for cheaper. Okay? You need to get a card to do this, but anyway, they have a lot of really cool stuff. Let me go back here to what I was showing. I haven't added this either, but the bill advocacy in the top deals with some of that stuff. Um, Short-term gap coverage, medical expense shield, hospital indemnity. So if you don't have health insurance because you cannot you are have Medicaid, you don't have Medicaid, you have made too much money for Medicaid, you make not enough money for ACA, you can get a hospital indemnity plan according to your zip code. Accident protection, cancer protection, heart attack, critical illness coverage. We got some other things that I need to add that I haven't added. Medicare supplement, I haven't added anything here yet. Senior dental coverage, that's there. Senior hospital indemnity, ACA Medicaid, ACA Marketplace, sorry. If you want to go here, you can click there and it opens in ACA and you can put your information. And it takes 30 seconds, guys, 30 seconds to get a 76501 so that you can see the plans. Who needs healthcare coverage? Let's say that you're 63, that you're male, that you smoke, and let's see, you are two people, you don't have anybody that lives under 19, and you are making $39,000. And then see what it's going to show. And then you continue. Let's say that you lost your health coverage, and it has to have happened 60 days prior. And then let's say that you don't have any doctors, any medication, because you're 63 and you're healthy, and that's possible. Then you can come here and see what they offer you according to your income. So when you go here, let's say that you go to the doctor and a year ago you had that you end up in the hospital. Okay, so we're gonna go to a place where they have some lower deductible that is not. Let me go back here. That you can pay, because again, if you don't get sick, okay, so let's say that you can. And let me take this. Easy. The best thing is Blue Cross and United Healthcare. And let me go here, 2, 4. Okay, that deductible is too high. Here. So let's say that you choose this one. It's a United Healthcare is zero deductible. The premium is what you pay monthly, 58.82. The health deductible is zero. Now the drugs, if you need drugs, that's a very big deductible. And deductible is what you need to pay before the insurance covers you that specific thing. Out of pocket max is that. So if you're a person that needs a lot of medication, I will go with, let me go here, because you have to, you need the lower. If you go to the doctor a lot and you need medication, maybe this one will be, but look at the difference. So if you're a person that is healthy, this will be maybe too much because you don't make enough money. You might end up going to the other place in HealthGap where it explains you can actually apply to private insurance and see if you get approved for it, because private insurance is underwritten and it's cheaper. Okay, so these are some of the resources that you can get in HealthGap AI. Okay, and if you need help, like I said, you click there and you put what you need and your age, whatever that is. And if you don't have insurance, then you go here. So it can give you a better answer. If you don't have insurance, it's sending you to Central County's Center for Mental Health. Well, that's if you need mental health. Heart of Texas Community Health Center. You see? So this is what I've been working. So, and let me show you Scout because I don't know. I haven't. Here is Scout. Let's go back here to, because I want you to show Scout. This is our mascot. Scout is our clownfish mascot. Why a clownfish? Because most people feel small when dealing with healthcare. Hospitals are huge, insurance companies are huge, the system feels overwhelming. Scout represents the everyday person trying to navigate an ocean full of challenges: medical debt, insurance confusion, prescription costs, unexpected emergencies. Scout doesn't beat the sharks by becoming bigger. Scout beats them by becoming smarter. That's the mission. Okay? That is the mission, guys. Going back to find care and go back to the veteran side of it. So, as a military spouse, this section is close to my heart. Veterans often have access to resources they don't fully know about. Military families move frequently. Coverage changes, providers change, networks change, benefits change. Many veterans don't realize how many resources exist outside traditional healthcare channels. That's one reason we build dedicated veteran resources into HealthGap AI. So, I want to leave you with this. Healthcare shouldn't require a PhD to understand. People shouldn't have to choose between groceries and medication. People shouldn't avoid care because they're afraid of a bill. And people shouldn't feel alone trying to navigate the system. That's why HealthGap AI exists, to help people find answers, to help people find resources, to help people make better decisions. One person, one family, one community at a time. So if you'd like to learn more about HealthGap, please go to healthgapai.com. healthgapai.com. Take the free assessment that you can click here and take the assessment in English or Español. Okay? And explore the resources, share it with someone who may need it, and remember, the goal isn't just living longer, the goal is living healthier with less stress, less confusion, and more confidence in the choices you are making. Thank you for all of you being here. And I see you guys later. Bye.
Paper trails thicker than a mystery novel. Cash flow ripple make the banks grovel. Phoenix rise both shut with precision. Generational wealth, that's the mission. Legacy locked, key in the safe. Phoenix flying, no time to waste. Stacks on stacks, building the base. Future so bright, can't see the haze. Securitors move, we the pros in the game. Trust airtight, playing no shame. Life insured, annuities grow. Seeds in the ground now, watch them show. Golden wings,